Hello, everyone. This is Lanny Smith. I'm the founding president for the first 5 years. I'm still on the board of Doctors for Global Health as the Liberation Medicine Council, and I'm here to talk with you about the origins of the group Doctors for Global Health. I want to be sure, though, as we start in, we Doctors for Global Health. We started 25 years ago, 1995. And now in the year 2020, it's very important to know our origins, but also our insertions. And so I want to say very clearly, Doctors for Global Health supports Black Lives Matter. We are against white supremacy. We are against systemic racism. We are working to be part of people having access to health care, health as a human right, everywhere around the world. We're a group that is not U.S.-centric. Even though we are registered in the United States, our vision is inclusive of people in many places, anywhere that people are working to fight, to struggle for human rights, for health and social justice, for health equity, for racial justice. And that does include the United States. And in this particular moment that I'm writing and talking with you, we know that things are very difficult. People are experiencing a repression that is extraordinary in the United States in some ways. At least it's extraordinary for white people. Not really extraordinary, unfortunately, for Black people. It's been part of the fabric of the United States since long before the United States officially begun. We know that, but really, if you read about what's happening in Portland right now, you think you're reading about something that could be happening somewhere else in the world. People scooped up off the street for participating, exercising their First Amendment rights to free speech. This is something that Doctors for Global Health feels very strongly about. We have people everywhere, but we have members everywhere around the world who are working to support the right to not only to expression, but the right to have help, and help does include expression. So where did Doctors for Global Health come from? We started the organization in 1995. It happened as a way of bringing together an initiative that had been going on for a few years before that, since 1992, in the country of El Salvador, in the department of Morazan, which is on the eastern part of El Salvador, contiguous with Honduras. And we started the group because in 1995, it turns out that there were a lot of groups around the world and in the United States that had been working in a solidarity mode, that had been working to try to accomplish an accompaniment of people around the world, but especially in Central America, who were in the struggle for their own rights and who were having that struggle really quashed in many ways, but by many governments, but none more clearly than the United States government. And so many groups had grown in solidarity and support of people, especially in El Salvador, especially in Nicaragua, especially in Guatemala, also Honduras. And in 1995, we had a lot of people who had been working from various other countries, keeping the eyes of the world on El Salvador, because at that point, at least, that was a good way to keep the death squads from killing people that were involved in trying to make a difference in their own health and lives. And we were working, doing a participatory investigation. We were working doing a project that had started in 1992 under the auspices of the French humanitarian organization Médecins du Monde, Physicians of the World, France. I had been invited to go in 1992 and look at some of the work that had been done there in El Salvador by this group. The connection was through one of my mentors and one of the people that was part of the beginning of Doctors for Global Health, Professor Jonathan Mann. And Jonathan Mann is he's deceased now. He died in Swiss Air Flight 111 over Halifax, Canada, in 1998. But he was someone, a public health expert who had in his time been the head of the World Health Organization, AIDS organization, and left that group and had become a professor at Harvard School of Public Health, and had gone around giving a series of talks looking at the unifying aspect of health and human rights and the synergy of those two. And he had many friends who had started the French group Médecins du Monde. That group was started by a French physician named Bernard Kouchner when he left another group that he'd started, which I'm sure many people listening to this talk have heard about, called Médecins Sans Frontières, or Doctors Without Borders. And that happened in around 1981 or so, because Dr. Kouchner at that point wanted to do a project to rescue the Vietnam boat people in the South China Sea and other members of the board of MSF. I didn't think that was a good project. So he left MSF, he started MDM. After that, he left MDM as well. But that's where MDM came from. MSF, where did that come from? Bernard Kouchner had gone to Nigeria, to Biafra, to be a volunteer in the Biafran conflict in 1971. And he, as a member of the International Committee of the Red Cross, the ICRC, and ICRC, as part of who it is, they don't officially publish and have meetings with the press about what they see in terms of human rights violations. Not usually. A few times they will. Generally, they don't. For example, they knew about what was happening in Abu Ghraib when the United States was torturing people to prison in Iraq. The ICRC knew about it, but they went to the United States government and said, you need to change this. That's the way they do things in prisons and other places, not have a press conference. But Bernard Kouchner in Nigeria saw some terrible things happening there. It was an armed civil conflict. People of Biafra were trying to have their own country. The British government and the Nigerian government were not supportive. There was a war, and there were a lot of human rights violations. So Bernard Kouchner left the ICRC, had a press conference, started the French Doctors Movement, became MSF, then went to MDM, and MDM had the project together, invited by the people in Morazan, El Salvador. And in 1995, it was clear that it would be very important to have a solidarity group that was based in the United States, but that was global in perspective. And so, because a lot of the solidarity organizations in the United States were actually disappearing, and because the needs in El Salvador were very clear, and the way that we were working was a little different than some places. We were using the methodology called liberation medicine. I'll talk about that a little bit more, but it's the conscious and conscientious use of health to promote social justice and human dignity. And we originally came up with that term when Dr. Mann invited us to give a presentation on our work in Boston at the Harvard School of Public Health. The Center for FXB, Francois Xavier Badenau, Center for Health and Human Rights. At that point, we were invited to give a talk, and we decided to present on our work as liberation medicine. By the way, the FXB Center is currently headed by Mary Bassett. I commend you to look YouTube and look at what she's been doing. She is a former health head of the public health department in New York City, and luckily she's now working out of Boston here, and really putting fire to the struggle against police brutality and the struggle against racism, looking at racism as a public health important matter. I'm going to just say a little bit more about the founding of Doctors for Global Health. We brought there were 20 of us. There were 20 of us who some were in their 80s already. Mary Lou Clements was one of them. She actually had known her I was lucky to have known her as an algebra teacher in my high school, but what she was doing was working with women's rights, using cooking to provide food for homeless people, working against repression in the state of Georgia. She was a significant force when she passed away. She and her husband were both on the original group of Doctors for Global Health, and also other people on this group who were quite extraordinary people. My parents were on the group. The Professor Sandy Kemp at Davidson College was a founding member. Dan Bausch, who currently is working in the UK, heading their international health work, and working at the London School of Hygiene and Tropical Medicine. Tim Holtz, currently a Rear Admiral in the Public Health Service, and other folks, Shirley Novak, who was was until she recently retired, working with children who speak other languages in the preschool arena, and doing through the Syracuse sister community, doing very strong work in the same community where we were working in Morazan. Also in that original group, Joy Mockbee, who heads a clinic in Arizona, in Tucson, and there was a physician's assistant who was in the group, who works in Henry Ford Hospital in Detroit. Salvadoran physician Maruca Figueroa Estrada, and a medical student, Steve Miller, who became the first president from Albert Einstein College of Medicine, who became the first president after me of Doctors for Global Health, and Audrey Lenhart, who was a student at that point at Davidson College and who currently works at the Centers for Disease Control and Prevention as a world expert on vectors that infect people with certain viruses like dengue fever. But beyond that group of 20 people, and I left out a few, beyond that group of 20 people, there was a group of more than 100, almost 200 people who served on the advisory council. And Jonathan Mann was one of those, but former president of Davidson College, Dr. John Kuykendall, another. There were people who were in their early teens, and people who were professors, and people who were members of social movements. And that's how the group began, Doctors for Global Health, a group that has always done its best to be open to anyone who, in their heart and in their actions, promote social justice. And not physicians are welcome. Anyone is welcome. The only folks I would say who we asked to put their work in another place than us are people who for some reason are not able to tolerate diversity in terms of people's gender or people's gender preference or people's work. Folks who feel like they have to tell someone who is Muslim that they should be Christian, someone who's Jewish, they should be Christian, someone who's Hindu, they should. Folks who have a religious imperative that other people think the same way they think. We request that those folks go and put their services elsewhere. But I'm so happy to say that within the group Doctors for Global Health, we've had tremendous diversity of spiritual perspectives, with donors and people on the board from many different religious perspectives, many different spiritual perspectives, many different ways of viewing the world, and it's very important that's part of who we are. Welcoming people, whether they're able-bodied or not, welcoming people no matter their perspective and practice in terms of how they see themselves. That's the beginning of the group. That's who we are still, 25 years later. We've gone through a lot of opportunities from then to now, and I'm going to stop here and welcome anyone who listens and who feels like this group could be a place where you could share your energy, share your aspirations to make the world a better place, share your thoughts and share your energy and share your joy as well, because as Emma Goldman said, if I can't dance, I don't want to be part of your revolution. And we take her perspective very seriously within the group Doctors for Global Health.